Morning, morning. Just quickly checked my mic and it wasn't working, so I had to reboot. Hopefully everything is good. Morning, Steph. Morning. Looks okay my end. Let me know if there's any sound problems, and I'll try and sort it out. Right then, it should be the last session for the elbow today. Just move that out of the way. There we go. And yeah, we're finishing off with the blood supply. We did start a little bit of it last week, but then it went a bit funny, so the videos weren't working. So those are definitely working today. And then yeah, and then we'll move on to the linking up the brachial plexus down into the elbow. So that's the plan for today. Then it may be finished a little bit earlier than usual. Usually we're about 40-45 minutes. It might be a bit sooner than that today. And then we'll start off with the wrist next week. So that is the plan. Morning, Caroline. Good to see you as well. Right, let's get you going. Not on that page. There we go. This is the one I wanted. Get rid of that. Okay, so this is where we were last time. This is where we finished. And if you remember when we were looking at the shoulder, we were looking at the subclavian veins, subclavian arteries, and then that linking up then into the vena cava and the arch of the aorta. So obviously the aortic supply for the arteries, and then the vena cava for the deoxygenated blood for the veins. And so this is where the vein network drains from, right? So we've got these quite common positioning for the veins on the arm, very kind of like standard, if you like, but there are variations of all of these, just like there are with a lot of the anatomy that we've seen. But these ones, if you've ever had a blood test, then you'll be familiar with these. These are the ones where they'll take your bloods from, and we've got the basilic and the cephalic veins here. So this one, the cephalic one, that's quite a common one that you'll see in bodybuilders, because it'll be quite pronounced. It's very superficial, quite pronounced, sort of in between the heads of the deltoid and around the pec. And yeah, usually that one's quite visible if you've got low body fat. And then yeah, if you pump your arm a few times, then usually these ones will stick up as well, and you'll be able to see these on the surface of the skin. Excuse me. Right, so let's have a look at those a second. Fingers crossed this will work this time. Yay, that's looking good. So these are the veins around the elbow. Excuse me. So the image that we've just seen, that's just overlaid there. And then here we are. So you can see how superficial they are, literally sitting right on top of all of the muscles, which we've been looking at over the last couple of weeks. So it's no wonder that these are easy to see. You can see the blue veins quite easily in the arm, and again, easy to get a needle into for access to take blood or receive medication, depending on what's going on. So yeah, the basilic vein, which if we go back to the PowerPoint, was this one here. Okay, and then we've got all these different little branches coming off from the forearm and the hand, coming back into the elbow. So we won't go down here because we're going to cover those in the wrist. So around this area here, the main things to look out for. So your basilic vein, your cubital. So anything to do with cubital basically means like the elbow crease. So the cubital fossa is the dip or shallow in the anterior elbow. So anything like that is anything with cubital in it is to do with that region. And then we've got the cephalic, basilic, all joining, and anti-brachial just here as well. So if we go back to that video, just start that one again. make some of these names make a bit more sense. Here we go. So again, that's the image that we've just seen. And then there's your basilic just there. So you can see it tracking a little bit medially, and then there's the cephalic there, more lateral, around the lateral aspect of the bicep, between your deltoid and your pec. There you go. That's the cephalic. Yeah, so that, like I say, if you've got really low body fat, you can usually see those quite easily. Antecubital vein, just pop that there. Yeah, so the old measurement of a cubit is from the tip of your middle finger to your olecranon process. Okay, so that's where the name is derived, or the measurement is probably derived from the cubital region rather than the other way around, depending on what came first. So we've got the cephalic going laterally, then we've got the antecubital, and then we've got the basilic. So they're all joining together like a bit of a network. And if there's a problem with one side, then the blood will drain to the other side. You get what's called anastomoses, which are like connecting vessels, and they can actually develop as well if there's an issue. So if you have a problem with returning blood supply, your body will grow new vessels, and with neovascularization, you'll grow a network to bypass structures if you need to. Sometimes it's easier in some areas than others. So there's the basilic. So this is coming up the medial aspect. So there's the bicep, brachialis. So brachial veins up around this region. And then there it goes, tracking up. So you can see all the little offshoots going off into all the muscles. So there's your biceps, there's your pec. And then there it becomes the axillary vein, which is what we were looking at in the shoulder. Peel back your pec, you've got your pec minor, all the nerves as well. So this is the neurovascular bundle. And then off it goes. Okay, and then that should join up nicely with the shoulder blood supply that we were looking at on the last session. Cool. Okay, and then we've got the arterial network, which run really, really close. Very similar names as well. So we've got axillary artery around the armpit area, the axilla area. Then your brachial artery on the medial aspect, or the kind of shaft of the humerus. And then depending on which way the arteries go, whether they follow the radius or the ulnar, you've then got the radial or ulnar artery down into the hand. But again, we'll focus on those areas when we start looking at the hand and the wrist next week. So let's have a look at the arteries. Excuse me. Okay, so again, that's the image that we've just seen. And here we go. So we've got axillary artery just here underneath your pec minor. There's your deltoid up there as well. So traveling down, so underneath the armpit, we've got, it then turns into the brachial artery. Bit of your latissimus dorsi there. So anything with, let me just pause that there. Anything with profunda in it, like profound. So if something's profound, it's very deep. And we've got quite a few profunda in the body. So the profunda here is profunda brachii, which is the deep brachial artery. So it's kind of diving down and then supplying the muscles of the arm, or the upper arm anyway. So you've got radial nerve just there as well, and you can see how it pierces through. And then there's the brachial artery coming down. That you can get a pulse there, so you can have a feel on the inside of the bicep. Squeeze in towards the humerus bone, so you're compressing the artery, and you should be able to feel a pulse. And as it tracks down, and you get to around here, so this is the bicep tendon. On the medial aspect of the bicep tendon, there is a very superficial area of the artery, and that, if you take blood pressure, that is where you listen to the sounds of the artery. So you can see exactly where you need to place your stethoscope if you do that kind of thing. So you've got median nerve on top, brachial artery just underneath, and then there's the bicep tendon, and then there's the brachial artery just there. So if you are doing auscultation, so you're listening for the artery with a stethoscope, then what you do is you get someone to tense their bicep so you can feel the tendon, and then you place the stethoscope to the medial aspect of that tendon, and around that area there, if you push the stethoscope down, you should be able to hear the pulse. Okay, so you should be able to hear the sounds of the artery there. And then here it splits, so it goes down into the ulnar artery, obviously along the ulnar, and then radial artery along the radius that way. So you've got pronator teres and brachioradialis, which we had to look at over the last couple of weeks. Ulnar artery is down there as well, brachialis just underneath. So again, it's quite superficial, the artery around this point. Cool. And that's your blood supply for the area. What you hopefully will notice is that the arteries, the veins, and the nerve network, they all travel very, very close to each other, and which makes it easy to identify where things are, and also the reason why there's multiple similar sounding names, and usually they're given the name of the location near a bone. So that's one of the reasons. That's good question, Rahul. To be honest with you, I don't take blood, so I don't know for sure, but I would imagine it's because the arterial network is under too much pressure. That's what I would suggest. And you wouldn't be able to easily take blood. You probably could, but you wouldn't be able to easily do it because the vein network, there's no pulse. So you just put the needle in, and then it's easy to take the blood out. But I would assume that's the case. But like I said, I don't know. I'd have to find out for sure. I'll have a look after, and I'll pop it in our group. And I'll mention it next week as well. So good question. Cool. Okay. So before we get onto this, just want to show you this. So a quick overview of the brachial plexus, which is what we've been looking at over the last couple of weeks with the shoulder before we started the elbow. And we were looking at, just pop that there, the roots here, C5 down to T1. So these denote the roots in the neck. Okay, so C5 is cervical spine 5, C6 cervical 6, and then T is the first thoracic. So these are all of the nerve roots. They then come together to form the branches, which is what we're going to have a look at now, because we're looking at the elbow. So they split into divisions, they split into chords, and then they go off in different directions. And then at the end, we've got the musculocutaneous nerve, the median nerve, the ulnar, the axillary, and the radial. Just move me out of the way. Okay, so we've got those 5 key branches that come off of the roots. Yeah, so we're getting to the stage now where they've already split because we've gone past the shoulder, and now they're split and they're going down the arm. All right, and they'll all go to their different locations depending on what areas they supply. So let's go back to this one. So if we have a look at the supply around the elbow in a bit more detail. Now, if you haven't done this with me before, then we've got different types of sensation. Okay, so we've got nerves. Oh, just moved my leg. We've got nerves where they pick up sensation in the skin. sensation from joints, sensation from the blood vessels, sensation from the tendon junctions in muscles, and they're feeding back to the sensory part of the nervous system. So it's all the sensation part of it. So it will be touch, it will be a vibration sense, it will be a speed of movement sense, so proprioception, and all of those sensors are feeding back into the sensory part of the nervous system, which will then go to a specific part of the spinal cord and then go up to the brain. And then we've got the motor aspect, which is the muscle part of the nervous system. So depending on what, if it's a voluntary action, so we have voluntary muscles, I want my hand to do a certain movement, so my brain tells my hand to do that movement, and then the muscles and the joints move because the muscles are moving them in a specific way. We've also got the involuntary muscles where things are happening automatically as well, so the autonomic nervous system, and they're all split into different sections as well. We did do a whole session on this a few months ago. Okay, so if you want a bit more detail on that, then have a look back at I think we did a whole session on the parasympathetics, autonomic. So yeah, it goes into a bit more detail there. So when you're looking at this picture, yeah, good point, Tris. Yeah, you'd need arteries have thicker walls too. Yeah, so you'd need to push a bit harder through an artery. I don't think it will be as pleasant. So we've got if we have a look here, so we've got derived from the lateral cord, which was part of the brachial plexus, and so that this is the musculocutaneous nerve. And if you remember back to the session that we did on the brachial plexus, it was the way to remember the muscle supply for the musculocutaneous is BBC. So we've got brachialis, biceps, coracobrachialis. Yeah, so if you're in the UK, obviously BBC, everybody knows what BBC is. And well, most places around the world do, to be honest. So yeah, BBC is a nice way to remember the muscles that are supplied by the musculocutaneous. So as it comes off the lateral cord, you can see here 1A, 1B, 1C. So that's the supply of these muscles. So you've got little offshoots of motor supply into those muscles, which then, when enough stimulus is sent to the area, then the muscles will contract. Okay, so you can see all those little offshoots there. Then we've got this one down here. This is number 2, lateral cutaneous nerve of the forearm. So this offshoot here is a sensory nerve. So it doesn't go to any muscles. What it does do though is supply this area of skin. Okay, so if there is a problem, like a compression or something like that of the musculocutaneous nerve, then it will, depending on the level of the compression, it will affect the muscles. So it affects the flexion of the elbow, but it may also affect this part of the forearm as well, the sensation in that area. So it might feel a bit odd, a bit pins and needly, that kind of thing, depending on what's wrong with it. So you've got the sensory part here, and then the motor innervation, which are the muscles up here. So let's have a look at musculocutaneous. Hopefully. Yep. Okay, so that's the image that we've just seen. So we got sensory and motor supply for the musculocutaneous nerve. And then here we go. So remember, it came off the lateral cord. So there's the musculocutaneous nerve there, right in the armpit, median nerve, and then ulnar nerve and radial nerve just there. So they're all very, very close together. But the musculocutaneous nerve will supply your coracobrachialis. There you go, there's the BBC. So it supplies the 3 flexors of the forearm. There it goes. There it is again, it's popping out there. So that's by your biceps brachii. And then brachialis underneath. And it will terminate around this area here, but in terms of muscle. But then the lateral cutaneous part of it, let me just play that bit. So you can see it supplying your coracobrachialis, and then it pops out in between coracobrachialis and the biceps, runs along your bicep, and then on top of brachialis just there. And then that little offshoot there, that's your lateral cutaneous to the forearm. Okay, so that's the sensory bit there. So that's what nerves look like. They're quite. I always talk about food when we talk about anatomy, but they're very similar consistency to like a squid. Okay, so if you've ever seen not a cooked one, but a raw squid, it's that kind of consistency. That's what they're like, and you'll have these little offshoots, these little branches that then go into the muscle, so that obviously it can cause the muscle to contract. Okay, now this one, a few more things that it supplies and that it does. Okay, so this is the median nerve, derived from the median and lateral cords of the brachial plexus. So again, going back to what we were doing when we're looking at the shoulder. So here's the nerve coming down here. It bypasses all of the upper arm, yeah, so that nothing happens with the median nerve in that humerus area, okay? It's not until it gets it down to around the elbow, and then if you have a look at the muscles that it supplies, we've got pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum, so on and so on and so on, okay? So what that shows is that these muscles are the ones, apart from pronator teres a little bit because of where it's attached, but these muscles will affect the wrist. Yeah, so if there is an issue with the median nerve, then it will affect these muscles, which will then affect the movements of the wrist. Not only that though, if we have a look down here, so the second part of the continuation of the motor part of the nerve comes down into the palmar aspect of the hand, so that the palm of the hand. And we haven't covered these yet, so I'm not going to go into too much detail with these, but they will supply the lumbrical muscles in the hand, and then also flexor digitorum profundus, so that must be a deep one, and then flexor pallucis longus, that must be a long one, and then pronator quadratus, that must look like a square. Okay, so again, we these muscles around here, pronator quadratus we've already seen because it was at the end of the radius and ulnar, and we looked at it when we were looking at pronation of the forearm. So those are all of the muscle supplies for the median nerve. Loads more muscles that it will innervate. Okay, and then sensory innervation to these areas just around here. Okay, so we've got the around the palm. Yeah, so it's the easiest way to remember it. It's nearly right, so it does help. So you've got those 3 fingers, median nerve. If you turn them upside down, then it makes an M, pretty much. Okay, you can make an M out of that. So that's your median nerve, and then if you do that, there's your ulnar nerve. Okay, so you've got median nerve, those 3, but it does supply a little bit of this one as well. That's why it doesn't quite work, but nearly does. So median nerve, ulnar nerve. Okay, so that's how to remember generally the difference between the 2. Cool. Right, let's have a look at the median nerve. Here we go. And again, continuation from the brachial plexus when we've been looking at that before. The median nerve is in the middle, hence the name. So there's the picture that we've just seen. So there we go. So there's the median nerve. Ulnar nerve is going towards the little finger. The median and ulnar don't supply anything above the elbow. Okay, so off the median nerve goes, down the inside of the arm, follow that, and then that's where the ulnar nerve splits and goes off on it and does its own thing. There's the median coming down there. So there's the median nerve. And then it goes between the two heads of pronator teres. And if you remember, we were talking about that before. So if you have carpal tunnel symptoms, so loss of sensation in these fingers, or you've got an issue with the muscles in the hand, the lumbricals in the hand, and some grip, then it could be a compression of the median nerve, but it might not be at the tunnel. Yeah, so it might not be at the wrist. It may be at this area here, because the median nerve goes in between pronator teres heads. Yeah, so the two heads. So if you do a job that or play a sport that involves a lot of grip, a lot of isometric, like holding around the elbow joint, using pneumatic drills, that kind of thing, well, that would affect the nerve anyway. Then you can get some compression of the median nerve at that point. I will play that again. We'll have a look at the course of it when we go into the rest of it, when we go into the wrist, because all of those muscles, they supply the they move the wrist and the hand. So nothing happens with the median nerve at the elbow. So yeah, that's when median and then ulnar splits and goes off that way. Median comes this way. There's your bicep. Brachial artery, which we were looking at before, brachialis underneath, and there you go. Okay, so you can see the two heads of the pronator teres. Perfect. Okay. And then we may as well follow on from that with the ulnar. So you can see that the ulnar was taking a slightly different trajectory to the median nerve. Yeah, so the median nerve was coming, well, similar kind of pathway till about here, till about midway down the humerus, and then it split and then came across the elbow and then through pronator teres. And then you saw the ulnar nerve just drop down and go towards this medial epicondyle. When we were looking at the bony anatomy, I got you to put a thumb on the medial epicondyle, middle finger on the olecranon, and then in between the two there's a little valley, and that little valley is where the ulnar nerve sits. So that's your ulnar groove. Okay, so it'll pass through the ulnar groove there. And then if we have a look at the muscles, look at all these, loads of them. Okay, so we've got loads of two big muscles in the forearm, and then loads of muscles in the hand. Yeah, so the ulnar nerve does a lot of work in the hand. So if we have a look here, we've got flexor carpi ulnaris, flexor digitorum, and then all the rest of these, so C down to K, these are wrist and hand muscles. Okay, so those are all the motor innervation. And again, we'll cover wrist and hand when we get to it. And then we've got the sensory aspect here. So remember I was saying that one for median, that one for ulnar. There's your ulnar. Okay, remember I said it is a little bit of that one as well. So there is a bit of a shared innervation on this middle finger. Okay, but generally median, ulnar will guide you in the right direction. Okay, right, let's have a look at the ulnar nerve. Just before we move on, just think it was kind of, it's all very nice knowing where the nerves go and where the arteries go and that kind of stuff. The nerves more importantly, I think, especially in terms of exercise therapy, physical therapy, that kind of thing. So if you're doing examinations on people when they've lost sensation, it's really important that you know the pathway of the nerves and the positions that people get their arms or their legs in that causes the sensation. Because then if you can envisage where that nerve goes, and then when somebody's in a particular hand position, so a classic is reading in bed and having your arms by your side and then holding the book. It's a bit old fashioned, probably more people are holding their phones these days, near their face as they're scrolling or they're reading, whatever they're doing. And then their little finger will start to go numb. And it's because of the position of the nerve as it's passing through the elbow. So because of where it goes, so have a watch of the video in a sec. So because of the angle at which it goes through the elbow, it will stretch and compress the nerve around that point. And if you hold it in that position, it will make your fingers go numb. Okay, so and it makes sense when you know where they go. Okay, so again, that's the image that we've just seen. Here we go. So we've got median ulnar nerve. So that was the split around kind of midway down the humerus. And then there it is there. Okay, so at the elbow, that's what it passes through. Yeah, so we've got this connective tissue covering the medial epicondyle going over to the olecranon. And that helps to keep the ulnar nerve in place. You can have an injury to this connective tissue, and what will happen then is if you move the elbow into flexion and extension, the ulnar nerve can flick out of the groove, and that can irritate the nerve and cause fibrosis. And sometimes you can have an operation to reconnect the connective tissue. Or what they do is they'll just leave the nerve flipped out of the groove so it doesn't irritate it. But if you then do a tin or tap on that person, they're not going to feel anything because their ulnar nerve isn't there. Okay, so yeah, again, useful bit of information to know, especially if someone's had an op on their elbow. So there's the connective tissue as it's going through. Yeah, it's called Osborne's ligament. I was trying to think of the name of that the other day. Couldn't for the life of me remember. Okay, let's have a look at that again. So here we go, median nerve at the top. So that's the last one we looked at. Ulnar nerve coming this way, medial epicondyle, olecranon, and then the Osborne's ligament over the top. And it's that Osborne's ligament that can get injured that will cause the ulnar nerve to flick out of its groove. And you can literally feel it. So if someone does have a problem with it, they flex and extend and you palpate that area and you can feel the nerve flicking over the medial epicondyle. Okay, so, I know because I've felt it. Not on me, on someone else. Okay, last one then is the radial nerve. And this is quite an interesting one. So we've got a bit of a supply above the elbow. So we've got 1A and 1B, so biceps and triceps. So a bit of a shared innervation with the biceps. So the lateral portion of the bicep. And then if we have a look down here, so 1C all the way down to 1N, pretty much, well, a little bit of elbow, but mainly forearm. So these are all your extensors. Yeah, so extensor carpi ulnaris, extensor digitorum, and again we'll cover these when we get to the wrist because there's quite a few to cover it in there. So the way that the radial nerve gets to this, the outside of the arm, is through that spiral groove. If you remember that from a couple of weeks ago, I think it was, might have been last week, when we were looking at the tricep muscle and where the different heads of the tricep attach on the humerus, and there's a gap in between, and that's where the radial nerve will go through. And then down here we've got the superficial branches of the radial nerve will supply the skin. Okay, so all around this area here, and then into the back of your hand. Okay, so that area of your hand. So again, we've got shared motor and sensory for this radial nerve as well. Okay, so it does dual jobs. Right, let's have a look at the radial nerve. Here we go. Okay, so again, just focusing around that elbow region, and then we'll work down into the wrist and hand when we get there. So radial nerve, there it is there, and then it flicks underneath and wraps around the humerus. Yeah, so there's the medial and long head of the tricep, so it'll go in between those. And then if we spin it round and then lift one of the triceps out of the way, there it is there. Okay, so it will track round the back of the humerus, in between those heads of your tricep, and then wrap around your humerus bone. And there it goes there. So there's the humerus just there. So this is now going to the extensors of the wrist. And there it is popping out there. So around brachioradialis. And then again around there, here we go. It's just popping out and coming through here. So you've got biceps brachii. And we've got a couple of different branches, so deep and superficial branch. Let me just play that bit again. And these will be, the superficial branch will be the one that goes to the back of the hand, so to supply the sensation on the back of the hand. So there it is around the back of the humerus. Brachioradialis just there. And now it's coming to the outside of the elbow. So this area here, there we go. And then there it is there. Deep branch going to the muscles, superficial sensory. Okay. Perfect. It's like there's always stunned silence on the nerves and arteries and all that. Just pop that back on as well. Cool. So there you go. That's the elbow done. Not bad timing either. It was about 40 minutes. So elbow done. Next week we're going to start to have a look at the wrist, and we'll start off with the bones of the wrist and then build up again like we have done for the elbow. And then once we've done that, we've then completed our third round around the body. So and I know some of you have joined me for all three. So I will see you next Monday, 10 o'clock. And yeah, have a great week. See ya.